we're back.
We are back and ready to get into our second conversation this morning. It is a perspective on the response to COVID-19 thus far. With us via Skype is urban planner Carolyn Trench Sandiford. Good morning, Carolyn.
Good morning, and it's always a pleasure to be on Open Your Eyes first thing in the morning. The only thing I'm going to miss today is to get that little smooch to say, hi, good morning, great seeing you. But I'm sending it virtually nonetheless.
I know. That's the part of the social distancing that's the hardest for me,
Yes.
not greeting with a hug or kiss. But it's great to see you, and you know, I think you have such an interesting perspective in terms of looking at or COVID-19 response. Now, as an urban planner, one of the things that you will always look at is change and responsiveness for change and preparation for change and execution of change. And while this may be a health crisis and a financial crisis, there's a whole lot of change involved as well.
Absolutely. I think one of the things that I kind of hallmarked in 2 articles that I had written on the issue was that we need to look at it as a potential disaster and not solely as a health epidemic.
Okay.
And I think if we start looking at it as a potential disaster, then we will be definitely looking at varying components of that disaster. And I think that is where we need to start going.
Yeah. So, you know, that's an interesting take, because it's a tough call, and I want to be clear, you know, the authorities are facing something like this for the first time. This is not a hurricane.
Absolutely.
This is like the hurricane came and wiped us out. Look at the shutdown in the tourism industry. But there's a tsunami coming, so instead of getting out there and saving people or doing anything, you have to let people remain safe until that tsunami passes. So it's difficult to be able to have measured responses or predictable responses, because there still is this uncertainty of how much COVID-19 will spread, how fast it will spread, or how severe it will spread.
Absolutely. And I think, again, if you look at what you said it's unpredictable. Yeah. Clearly, COVID-19 is novel, so we are learning as we are going along. Mm-hmm. But while we are learning as we are going along, we also have to find ways in which we can be iterative in our decision making. Mm-hmm. Yeah. And I see some elements of that within the COVID-19 response. However, what I am not seeing yet, and it doesn't mean that it is not happening, is how we start talking about resuscitation and recovery. Mm-hmm. And if we don't look at knowledge platforms, for example, how is it that we are documenting what we are learning, what worked, what did not work? How is it that we are leveraging the assets that we have? Yes, it's new, but there are some components of it that you can look at, as I have previously said, as a potential disaster. Mm-hmm. For example, let us look at the assets that we have. One, if you look at disaster management and disaster and emergency response, there are phases to it.
Yes.
There is preparation, there is response, there is recovery, and there is reconstruction. Mm-hmm. So you have the phases that are there. You also have different structures in place that have a combination of state and non-state entities. Because you have the government, as well as you have some aspects of civil society. Yeah. And then you have it operating at different levels, at a national level, at a municipal level, and at a village council level, at a village level. So you already have these structures in place with people who have a wealth of knowledge and experience in working on the emergency situations, as well as working with vulnerable populations who are the ones who are disproportionately impacted on. Yeah. I heard you talking a little earlier, for example, just as an example, of the whole issue of dialysis and the impact this whole COVID-19 have had on persons who have to get treatment for dialysis. Yeah. Now, if you are working with the structure that's in place, you would have had a Belize Diabetes Association, for example. or the people who are functioning in the dialysis response. And they would have been able to tell you where our dialysis patients are,
Yeah.
what would have been the impact, and so the response then would have taken them into consideration.
Yeah.
Another critical example is the villages. There are many villages who don't have water systems. Yet, one of the key mitigating measures for COVID-19 has to do with washing your hands.
Yeah.
So if you don't have water, how is it you're going to wash your hands? So you have to then respond to those using the structures. Now, it doesn't mean that you use a structure, only that structure. You then adapt that structure because, of course, there is the health component.
Yeah.
And I, for one, believe that the health component has been doing a wonderful job. I was listening earlier to your conversation, and the fact that we have 18 cases and 2 deaths, unfortunately, does speak to some extent that we've been, at least so far, coping.
Yeah.
But
So
there is
let me
the other
just dive in
component.
here for a second. So the article that you penned, putting it on the table, had a breakdown of different areas, including leveraging the assets. And
That's
you know, when I
right.
read it, I was most surprised because it seems so commonsensical. Like, and I don't know, I can't say with certainty that these issues have been looked at. You mentioned the dialysis patients, for example. I can start with that one because I did a story on it last week, and it is a heartbreaking situation where dialysis
Certainly.
patients cannot get to their dialysis because there is no public transportation.
Exactly.
Last Friday, I confirmed that one young woman died as a result of not being able to pay or make her way out from Stan Creek to Belize City
Yeah.
for her dialysis treatment. So what has happened is that we put these regulations in place, but we haven't done the checks with institutions. I can say as well that the Dangriga Cancer Society or people seeking cancer treatment are also facing the same situation. How are cancer
Absolutely.
patients getting to Dangriga for treatment? If they have to pay for it, how are they going to pay for transportation as well? Because it has to be private at this point. So you talk about looking for the data where it exists. SIB,
That's right.
Diabetes Association, Kidney Association, Cancer Society, and
The
getting
health
the
page,
numbers,
health page.
yeah, the
Health
elderly population, and get
That's right.
numbers and locations and statistics and start with
Exactly.
protecting those who are most vulnerable. That's the
Exactly.
premise of your point.
Exactly, but also I think when I noted the issue that we have to look at it as a potential disaster, also took into consideration that because you cannot look at COVID-19 solely as a health epidemic, and you can look at it only as response in terms of the norm, you also have to look at what are the pre-existing conditions. And I think this is where it comes in because it's not just health. We have to look at issues of poverty, for example, because when you talk about locking down the country and you're dealing with scenarios where people are what you call catch and kill, they're day to day.
Yeah.
They don't have storage, they may not have electricity, they may not have a fridge. There are many other issues that come into effect. So I think what has been happening, the government, to what I am seeing, and I can only go, let me be clear that I can only go by what I see reported, is that they are responding, but I don't think they're sitting down and actually looking at it and say, well, if I do this, this could be the impact. But not only what could be the impact, who are the people that we need to consult? And I think that may be a bit absent, and this is why I'm saying that, yes, it's a learning experience, and we have to treat it like that, and we have to know that mistakes will be made because it's new. But as we are going through it, let us start documenting what worked, what did not work. Let us use the data, as you have rightly said, that we now have and are even gaining. Let us
Carolyn.
look, for example, on the unemployment benefits that were applied for. My understanding was that it was over 60,000. And I think at the time, if I looked at some potential data, you were talking at that time about 30% of the population that have the age group to work. It doesn't mean that everybody within that age group can work, but just on a rough scenario. Let us look at who are the people who are employed. There was an initial emphasis on the tourism sector, for example. So we kept hearing a lot about tourism, but it is not only the tourism sector that is going to be affected. So this data now that you're going to have is going to talk to you about where people are applying from, what back trade they're coming from, age, sex, and so on and so forth. So you can start feeding this into the recovery.
You're speaking of demographic information at this point, essentially.
Exactly. But not only that, because remember, you're talking also not just the age, sex, and so you're also talking about the economic side of things, because you're looking at what background, what trade are they coming from, where were they employed. This becomes crucial if we start to talking about how we need to diversify our economic recovery and resuscitation. It becomes also important to know what areas of the economy are going to be on hold, because if we're looking at tourism, for example, you're talking about when we are now in the height of the tourist season. So this is going to close off, and the next season comes back in, I think, November. But how is it that we start to move towards becoming a more resilient Belize, meaning that if we are more diversified in our economic base, then another COVID-19 or 20 or whatever comes at us, we may be more resilient. In other words, the impact would not be as devastating as we are now seeing it.
Well, this
so
is
how we use the data as we are moving along becomes very key in terms of iteratively looping it back into the decision making as to how we start to prepare for post-COVID-19.
But this is the wake-up call that perhaps we've all needed as a nation to realize that we can't hedge all our bets, or we can't place all our eggs in the so-called tourism basket. Because we're looking at a situation now where the recovery will force us to have to diversify. We can't only simply base on strengthening or rebounding within the tourism sector if we're not looking at agriculture, if we're not looking at other areas of productivity as well, correct?
Absolutely, but also we have to start looking at what that data is saying to us about our vulnerable populations. When you look at the pictures, for example, of where let us look at the pantry system, where you're seeing the long lines for people who need to apply for pantry, when you're seeing 60,000 people applying for unemployment benefits and so on and so forth. It is also telling us that we are now seeing the manifestation of blatant economic and social injustice that have manifested to where we are today. So our recovery efforts is not just about looking at economic indicators. We also have to start to look at human development and social well-being indicators. How can we make our population more resilient? So the economic recovery and the sustainable livelihoods concept has to start coming into the play. So it's not just about, let us get the traditional economic activities back. No, it's about diversification of the economy, but it is also to ensure that the wealth of this nation gets trickled down to those vulnerable populations so that they can have a better quality of life. So when another pandemic may come around, the government doesn't have to put out so much, and we can recover faster.
Well, I think one of the things that we have said repeatedly, time and time again, maybe even in our own personal lives, everybody can be just one paycheck away from poverty. And
exactly.
There are some people who are 3 paychecks behind, or even more, depending on when they were forced to close or when they were no longer allowed to work. So we know that people who perhaps were, doing okay are now definitely not. They're facing the reality of not being able to provide. So a pandemic, let's be clear, is a major blow, and it's not anything that anyone can play a blame game with. It's here, and we're figuring out our way through it. But what I like is that you're saying, we're going to make mistakes. we're gonna trip a bit, but let's just get our stride right. Let's go back and check the data of who the vulnerable populations are, not just health-wise, but economic-wise.
Exactly.
Even looking at dense areas, because we know population density may have an impact. In other words, if I live in a yard that has 25 people, social distancing is anything but impossible.
Absolutely.
So those
And
are some of the
this is
things.
where I talked about how we can assets in that just recently, for example, the Statistical Institute of Belize underwent a national georeferencing to prepare for the population census.
Yeah.
So there's a lot of data that we have that we can start looking at. And again, if you work with the municipal authorities, if you work with the village councils, you can start identifying where are these areas that we're going to have challenges with and start preparing for them. Even when it comes, for example, to the distribution of food. If we're talking about things like social distancing, you can't have these what I call centralized locations for the distribution of pantry. Why not create community banks where you have less people, it is easier to social distance, less people interacting so that they can get the necessary food. So I think these are some of the things we are, as we continue to say, we are learning.
What you're saying is
earlier, Marlene, regarding the issue where it's different from a hurricane. Because if you recall, when we do have a hurricane, yes, it's a lockdown. To a large extent, it would affect maybe one part of the country. So the rest of the country can maybe come in and assist. The rest of the world would come in and help us. But when the rest of the world is in the same boat as
we got to paddle for ourselves.
Thank you.
Yeah.
Exactly.
Let me just move to the second point, because you mentioned the pantry system. We have the images up. Clearly, these people aren't standing in a line in the hot sun in vain. They want to have access to affordable food under the pantry system to be able to provide for their family. So not, I think sometimes we have to release ourselves of the judgments that we do have. But what your second point is kind of tackling this, which is we need to be innovative in this time. It's fascinating to see how businesses in Belize have wholeheartedly embraced online services. Because when you are forced to, sometimes you must innovate as a matter of survival. But that also expands to other programs, perhaps like the very pantry that we're looking at this issue here.
Absolutely, absolutely. And I think you quite hit the nail on the head, because oftentimes it's in times of adversity that innovation springs. And what this is saying to us is that Belize has a lot of potential. It has a lot of untapped potential that if encouraged, that if the environment is there to facilitate unleashing this potential, there's a lot that can happen. And so we need to start looking at how, for example, how technology can better be used to provide better services for these particular communities. One of their toolkits, for example, that we have seen where people can immediately put in information, gives their location, and you can know exactly where you have challenges for food. So it's not necessary that people go to a centralized point. So these are some of the things that we need to start looking at, how people can gain access to vital information. There are issues, for example, when it comes to medicine and getting educational resource material. As far as I recall, Marlene, and I'm not sure if you all have seen any latest data on things like cell phone penetration into Belize. But if you look at that data, I mean, nearly everybody in Belize have a smartphone.
Yes.
So how can you use that?
SIB does have that data, just to say. So
exactly. So how can you use that data and having people who have their smartphones, because you are going to have issues. The issue is not just one that is linked to COVID-19. You do have other medical information. One of the things that captured my attention, for example, was when I was watching at the two deaths. Unfortunately, two persons that I knew. There was this scenario where persons went to private sector institutions
Facilities, yeah.
prior to going to the health system. How can we get information more to people to call or link back to the Ministry of Health systems?
Yeah.
Because everything is important. Time is
Yeah,
important. How do you deal with medical emergencies, for example, when you have people maybe in communities, let us say with London bridges?
Yeah.
You know, how is the ambulance going to get in there? How are you going to get people out?
Yeah.
So there's a lot that we can do in terms of innovation and adaptation. And it is not just about now. If you go back to South Korea and you go back to Taiwan, what you're going to see that one of their key strengths had to deal with data infrastructure.
Yeah.
Yeah.
They were tracking people on their cell phone to see if they were following
Exactly.
quarantines.
Exactly.
Yeah.
So things like that, again, like I said, we are learning. And as
Yeah.
Belizeans, even though I use that word mistakes, people will tell you, I like to say, we don't have mistakes, we have experiences. And we learn from them.
Yeah.
So it is how we take and I go back to how we take what we have and we adapt as we move along. And in that way, then we can minimize the cost, the health, the number of lives that lost, but enable us as a people to bounce back quicker.
So can we reiterate what you're saying then by surmising or putting it together that perhaps the response from the government and all the various agencies need to be more data-driven in terms of being as effective in reaching out to these vulnerable populations?
Absolutely, but not only data-driven, it also has to be wider. In the point I have been making also is that we cannot just look at it as a health epidemic, but we have to look at it also as an issue of livelihood. And we have to take into consideration our pre-existing conditions, because I spoke of a pre-existing condition as poverty.
Yep.
But another pre-existing condition also has to be the whole issue of the government structure. The fact that you have a situation where people have low trust in government. How do you get out information to make people believe in what, in what is happening?
Yeah.
We also have the issue of the hurricane season coming up, for example. We have drought that is taking place.
Yeah.
So how do we create a government system that is not just data-driven, but a governance system that is integrated?
Yeah.
And I think that is what I find sometimes tend to be lacking with government response, that we tend to just be looking at, okay, this is happening, we will respond to it, but let us look at this happen, what all can be the impact of it.
Yeah.
And I think that integrated approach then lets you look at the economy, lets you look at the social issues, lets you look at infrastructure issues, and so on and so forth.
And I think that is a crucial point, because where we all are guilty of first just looking at this as a health issue, and we wanted to see health personnel directly addressing it, as time goes by, the picture broadens, and we know that it includes kind of the economy of the country, but most importantly, just the individuals and how we're affected. And
absolutely,
it's unfortunate we're not going to have the census, because we won't have the updated poverty numbers. And now with COVID-19, it will be completely skewed because this new tragedy will change the financial situation for many. But I want to go back to something. You spoke of the information flow, and that people are accessing private health care instead of calling the hotline to get proper guidance. And when they access private health care, they're exposing people unnecessarily. So that really is your third point, and clearly because of our business, it's an important one. It's about communicating effectively. Because I'll tell you this.
And timely.
Because I'll tell you this. Every single press conference, there are multiple, we're running PSAs from February on Channel 5. All of this information is out there, that if you have the symptoms, you call, but we're still not seeing the level of action that we'd want to see. And it's clearly documented in some of the positive cases that we've heard. So it's effective communication that seems to be a challenge, and also timely, not allowing rumors to run for a long time.
disinformation. And certainly it also has a lot to do with how you target your messaging, because a message to you and me may not necessarily be how we interpret it, may not necessarily be how somebody else interprets it.
That's right.
And when you had a scenario, remember when there was a scenario of the SI, where the Attorney General comes out at 9:15 on, I think it was the day before the SI was supposed to become effective, to explain it. You had an attorney who understands the law, who then says, no, what he's saying is illegal. And then saying to the commissioner, this is on social media, that the commissioner must not enforce it. And then coming back, accepting that the person accepted that they were wrong, came back and say, you know, well, yes, it is correct, but it had to be read in conjunction with another SI.
Yeah.
Now, Marlene, how many of us are going to look at two SIs?
Even if we do, how many of us can understand
the
it?
language.
Exactly,
Yeah.
understand that language.
Yeah.
So that
and having an
becomes
attorney
very-
explain it isn't always better, because they still talk
Exactly.
legalese.
So it's how you take that message and target it to your varying audience.
Yeah.
Yesterday there was a major conversation again on social media where the one person was saying, the minister was saying, you cannot come out on a Sunday. They had issues because they had an elderly person that they provide food for. The commissioner comes out and said, well, you can take that out. But then the person is saying, but the minister is saying we can. So who do you believe?
It was the same thing with exercising at one point too. It was,
Exactly.
no, you couldn't exercise. Yes, you can exercise. And then it had to be clearly stipulated.
And I think the commissioner, because the commissioner deals with the day-to-day scenarios.
The on-the-ground
People
scenario.
are on the ground, so he is understanding what's taking place on the ground.
Yeah.
So when you say medical emergency, some people may say, oh, that if you're really sick, you have to ask for the ambulance, or you have to rush somebody to the hospital. Yeah. But for others, that medical emergency may be, you know, an elderly needs a medication at a certain time. They may be blind, they may be disabled. There are other issues that intersect. People, lots of our elderly population, you all know, live on their own. They don't want to leave their house.
Yes.
No care how you try, ask them to move and come live with you.
Yeah.
They don't want to leave. Yeah. So how do you deal with that? And I think those are where I call the mixed messages that we have to work on to ensure at the end of the day that we reach the right population with the right message at a particular point in time.
I mean, I think, to be fair, the regulations are made for the better, for everyone. It's kind of like a blanket move. But there are anomalies in every situation. Not even anomalies. There's some populations that we perhaps don't think of how challenging it is. I think the self-isolation in an overcrowded house is one. I know the commissioner had to give special mention to say, don't worry, essential workers, you can still pick up your children after 4 p.m. Because we had another message being communicated that even if you're with your mom after 4, you're not supposed to. So
absolutely,
it's things like, I mean, I understand that we need to be stern, but it's the message somewhere.
Right.
So you talk of that being a part of the response that's important. And language, we've seen for the first time where Spanish translations are done for almost all the, we haven't seen this in a while. And I gotta say, I commended them for the sign language, but they had sign language before they had Spanish.
I was going to mention that as well, because, and again, it goes back to learning. You know, it's a learning curve. And I think this is where I keep emphasizing the importance of, we are in uncharted waters. We accept that. We accept we are going to have experiences that we are going to learn from. So this is why it's so important to document what we're doing, what is working, what is not working, what happens next, so to ensure that at the end of the day, if there is another one that comes at our doorstep, we are better prepared.
Yeah, and I have to say this much. I think that your point on communication effectively and timely, in terms of timely, I think we're doing a lot better than we've seen in many other crises.
Definitely, absolutely. Absolutely.
online platform.
Thanks to the technology at hand.
Yeah.
And another thing, because when we were looking at adapting, for example, and messaging,
Yeah.
A lot of the messaging really is by social media.
Yeah.
A lot of the messaging require internet infrastructure.
Yeah.
Because I can tell you, as the experts, I mean, it's just a wonderful component of the whole messaging.
Yeah.
And all the media houses, including yourselves, are doing such a wonderful job in terms of getting out these public service and also having the conversation that we need to have, because as we have the conversation, we learn more.
Yeah.
Your experience is different from my experience,
Yeah.
but together we make one nation and one country. So it's very important that everything that we do, whether we are talking about economic recovery and livelihoods, whether we are talking about healthcare issues and messaging, whatever we do, we take into consideration we're dealing with a whole, but you have different groupings of people that you have to deal with differently.
Yeah. Yeah. And your final point, I don't want to lose time. We have to get to this one. It's about planning for economic resuscitation.
Absolutely.
I know that we're in a spot where it's hard to see the end, but we do know certain things about the end of whatever the lockdown, the state of emergency will be. We will have a very severe financial crisis locally, and also the implications of whatever financial crisis takes place across the globe. You're saying
Absolutely.
now is the time to plan.
Actually, we should have started already, but there is no better timing than starting now. And I think, again, I keep going back to this, that there is a lot of information, there's a lot of data that we now know that we can use in terms of the planning for the economic resuscitation and recovery.
Yeah.
I think what we're going to have to look at is that just as how COVID-19 kind of put a jolt in our lives, we have to think of some radical economic resuscitation and recovery plan that is going to jolt the economy. At this point in time, we really need all hands on board. And I think this is a challenge that Belize has continuously faced, that we seem to think that there are few people who have a monopoly over ideas. I think...
Well, I was going to ask that. Who should be involved in this type of planning?
Well,
Because
again,
naturally we want to think of economic experts, but
absolutely.
I also think sometimes not having people from the social sector involved, because the livelihood and the day-to-day experience of even your politician or your top technical people is a lot different from the people who are standing in that pantry line. So in perspectives...
Absolutely.
Shouldn't it be a well-rounded, holistic approach then that involves everybody from every sector of society?
Yeah, there is always a necessary for some entity to lead. And clearly that's why we elect governments. Governments must lead. But we have long moved away, and I've said this point already, have been big on the show. We have long moved away from government to governance. What we need to look at is a governance structure that is going to lead the effort. And that governance structure can't only focus on the big people, meaning the big economic players. Yeah. We need to understand what the small economic players, what has taken place in their lives. If you look at how we have been dealing with this with COVID-19, you're going to see all the big people are still functioning. The poultry people, the big supermarkets, and so on. But what's happening to the tacos vendor?
It's
or the
small businesses, yeah.
Mm-hmm. Pardon me?
It's the small businesses, the micro businesses.
Exactly. We have not even looked at how we could have integrated them into the whole this crisis period. One thing, for example, I remember seeing these little bicycle carts with their fruits moving around, and their vegetables. You can tell me why is it that we could not have them continuing, and you just link them to particular areas. You put your leaf vegetables for a bag, for a stick, you put it in the yard, then put the money on the stick and you take it out. That's how you adapt. Yeah. You get, so we need to, whatever recovery and resuscitated efforts, we need to include the macro players, and we also need to include the small people, but we also need to include the technological people, because moving forward, COVID-19 has given us a sort of leapfrog into technology and how we use technology. we need to start applying our technology to our economic sectors and to our social sectors.
Is it fair to
that
say?
process needs to start.
Is it fair to say that these are the experiences we would have learned now in order for us to plan ahead for another situation such as this, simply because no one foresaw COVID-19, right? And so we were waiting for it to get here as an inevitability. However, the window of time for all of this planning, we didn't have that. So I would want to think that fortunately, the government was proactive enough to at least get something going. But as we're saying, it's a fluid situation where we're learning as we go along. So therefore, some of the experiences that we're having now can help us to better prepare for another time around, which would perhaps include the micro players, such as the tacos vendors, the other small parts of the economy that is equally as meaningful as the big business.
Definitely, but also let me be clear that let us not in any way remove ourselves from the fact that governments ought to be engaged in scenario planning.
Yes.
We always must be ahead of the game. We must have teams within our government that are constantly looking at the radar. Things that we can tell you as planners or economists or so is that you look at what's happening regionally, you look at what's happening globally, and it more or less tell you what's going to start coming at you. So you always have to be in this scenario planning. Admittedly, let us also accept that we are now moving in a time of unpredictability and uncertainty. Planning 25 years ago, you would have heard about long-range development plans and so forth. No, it doesn't mean you don't do that. But you have to have institutions that are more agile, that are more flexible, leadership that understands that it's a parallel scenario while you're moving towards specific national development goals. At the same time, you're dealing with things that are coming at you. So your mind has to always be what is on the radar and what the impact of what is on the radar, how that is going to affect us. We knew COVID-19 was coming. That ought not to have stopped any planning that we are looking at for 2030 or 2040.
Well,
Yes, we are learning, and sometimes what COVID-19 does to us is to say, okay, if we want to reach there, what is the impact it has happened, or where we want to reach, is that even relevant anymore?
Well, that's one of the things I wanted to ask, because, we entered into this period or faced the pandemic right after the first budget reading. So there were all these projections made, but there was also allocation of funds for specific activities. I know the Prime Minister has talked about working with international institutions, financial institutions, about kind of reworking the budgets. But in my mind, some of the heavy tourism infrastructure that we felt was urgent now is probably not as urgent, and that money can be reallocated for other uses. I mean, provided that you can get the financial institutions on board. Let's use case in point, the $10 million road. I mean, how many tourists are going to be going to Caracol right now if that was such an urgent need?
Absolutely. And again, it doesn't mean that the Caracol Road may not be important in the scheme of things. But we have to be able to adapt and respond according to where the relevant needs. And I think one of the key things that we have to start looking at is how we start moving, using this period to move towards economic diversity that looks at the big picture to ensure that every Belizean is going to benefit from the wealth of this country. I mean, that has not been happening. COVID-19 exposed that to us. And it also said to us in some ways that there are key policymakers who have not a clue as to what's happening on the ground. And so at the end of the day, these things have to come up to us. They're start. They have to come to us, and we have to take it into consideration in terms of moving forward.
It is a very delicate balancing act in being able to meet all the needs of right now, preparing the healthcare sector in the case of a worst case scenario, working with the people to avoid that worst case scenario, providing for whatever is lacking in terms of basic needs, while also thinking of how you will ensure that collectively we'll be able to survive whatever financial blow happens at whenever this
Absolutely.
ends. And
And
so,
you mentioned the budget. The reality that budget is no longer relevant.
Yeah.
yeah,
You know?
yeah,
Yeah.
That's the
true.
reality that we now face. But who would have thought of that 5-6 months ago? Clearly, and even what COVID-19 is saying to us is that we need to transform government.
Yeah.
We need to do a sort of radical transformation of the government to be able to respond more effectively
Yeah.
to what is going to come at us in the future.
And just one last point, I think, because we brushed over it. It's also accountability, because we don't want to think of that
Absolutely.
right now, but there's no point in doing
Absolutely.
an audit 5 years from now. Let's just have full transparency from now as to where the monies are coming from, where they're going, what is being shifted in the budget, and let us know and understand as we move along. I think there's a lot of
Absolutely.
understanding for change, but we won't be naive enough to believe that we should always still demand transparency.
Absolutely, and I think what is also key, you did mention that, for example, the Prime Minister mentioned that there are international partners that are out there willing to work for us.
Yeah.
Let us be mindful also that we are also a country that is very high in debt. So our recovery can't be focused on borrowing more money. Our recovery is going to have to start looking at how we can leverage those assets that we continuously have, that we have within our own country, to remove that debt burden. That has to be key. Another thing that has to be key, and I continue to emphasize this, is that it is not just about economic indicators. It's about how we use this opportunity to start to recharge and resuscitate an economy to ensure that the wealth of this nation gets trickled down to those persons who have been excluded from the development process in this country.
All right. Well, you know, I'm always fascinated by how your mind works as a planner, because, and I've said it before and I'll say it again, it's just simple things that we have as an afterthought that can help us so much more if we include it as a part of our decision-making
Absolutely,
process.
absolutely.
So thank you for sharing that with us this morning.
And it was my pleasure as usual, and I can get used to this virtual space thing.
No, we will get back to the days where we have human interaction again.
I heard you. There's going to be a new normal post-COVID-19. You just watch it.
All right, Carolyn,
Thank
stay
you.
safe, and thank you for your feedback.
You stay safe too, both of you. Bye-bye.
All right.
All right.
Take care.
All right, with that, we're going to go ahead and take a break. Of course, the show continues. We'll keep on bringing you as much information as we can to help you to broaden your perspective. This next one, Isani, is really important. Dr. Hidalgo said it. You know, he believes that people should be wearing masks. The Prime Minister has advised the same as well. But there is something called mask etiquette, which means there's a right way and a wrong way. We're going to be tackling that after the break, so stay tuned.